Dr. Hellings, what do you see as barriers to go towards implementing this on a broader scale?
Implementing the digital tools or implementing an online consultation?
Implementing digital tools.
Well, first, the tools that are really patient-friendly and helping the patient further in a personalized way still need to be developed, and the current tools can always be fine-tuned and improved. So I think that's the next step. The second step is to convince all the healthcare providers to recommend the tool and not consider this tool as a kind of threat or as a kind of alternative for a medical outpatient visit, which is also a reality that we are confronted with. At this moment, we recommend My Sinusitis Coach and Rhinitis app to our patients, but not all physicians are doing it right now because they still think it's very valuable to provide educational information to the patient themselves, whereas I consider it as a time-saving opportunity to allow the patient to go and download the app for free and get all the information that they might be interested in on disease development, treatment options, what to expect from the treatments, and what would happen if the treatment is not effective. So I do think the development of the tools is top priority number one, or fine-tuning of the tools. The second priority is actually the dissemination of existing tools, and the third priority will then be to merge existing tools into one integrated solution, one integrated digital solution that is really helping the patients largely and better than they're currently helped by the healthcare systems in Europe.
Dr. Usmani, will it go so far as that a doctor will be prescribing an app?
Well, I'll answer that question in a different way. I mean, we're sitting here as proponents of digital solutions and possibly being evangelical about the digital arena. But Anne brings a very important point, and she doesn't want, if I interpret it right, maybe every time to have an online connection. And digital may not be the solution for everybody, and it may be a complement. And actually, again, at the ERS I presented on digital solutions in asthma, and there was an article written by the president 2 years ago of the family practitioners of the American Society of General Practitioners, and the lead title was, "I don't want to treat a computer." So he does not want to engage, is my understanding from the article, with his patients via computer. So you have different perspectives. And I think the challenges for digital, in addition to data, as well as you described, the back end. So I've learned a lot about the technical aspects of how data is encrypted and technology along the blockchain approach to give the reassurance, to communicate to patients. This is the data we want. How is your data being used? What we may be able to achieve communicating about the disease, collecting information. And what I was going to say is it's still not proven that a digital solution is economically beneficial, and those studies need to be undertaken before we are actually going to empower governments to actually give an arena for implementing a digital solution.
Jean Bousquet, I know you're a visionary man. Will, in 10 years' time, doctors be prescribing apps that will be reimbursed by the government?
Of course. It's like, well, I had a meeting 20 years ago with Monsanto, and where many people opposing them, and at the end, the guy said, well, in 20 years you will all eat our food. And he's right, because we don't know what food we eat, but we probably eat genetically modified food. So in 10 years, everyone will use digital health, or the doctors will not exist himself or herself.
Dr. Hellings?
I fully agree with Jean, but I must supplement here that if we currently recommend the app to the patients, I esteem that about 70% of patients are willing to use the app, whereas there is some resistance in about 30%. So having said that, I do think it will be prescribed, but that does not mean that all will use it. We can recommend it, we can offer it as a tool to achieve personalized care, but we cannot reach out with these tools to 100% of the patients.
Well, I'm going to tell you something. How many people are not using internet today? This will be the answer in 10 years for doctors.